But if I say you pose it for it, yes.
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 Yeah, so tell me how you became outreach worker.
Well, it really, as an account of NASTA, that they were doing a research project that looked at sex workers, transgender persons, and men who have sex with men as key populations. That's to say, they were vulnerable populations for HIV. And we needed some Spanish-speaking persons to interview the Spanish-speaking sex work population. So I started doing those interviews, very extensive interviews. So I came to know a lot about the population, like where their entire history, so where they came from in Venezuela or Dominica or Cuba even, Argentina as well. What their lives were like when they were in their original countries, whether they were teachers, whether they were students at university, nurses. Most of the population I interviewed were actually professional body of people. And in doing those interviews, studying their sexual practice and how they access HIV healthcare in Trinidad, I became very familiar with them. And even after the interviews were done and the research was wrapped up, it's still currently being analyzed, yet to be published. I still continued meeting with the population, going to the bars, handing out the condoms, having those conversations, facilitating spaces for them to go get tested, because I feel really afraid to just walk into a health center and ask for an HIV test.
Why are they afraid?
They're afraid because the police arrest them. If the police see them, they stop them and ask them questions and harass them. They feel challenged by language barrier going there and not finding people who would speak Spanish with them. And they are treated as if they're not even a subhuman population, like they have no right to come into the health center and demand the services. They get that kind of stigma from the professional body as well as the persons who be sitting there waiting, because there's this default assumption that because you're Spanish or Latino even, that you're a sex worker. So it's very intimidating for them. And they don't want to get arrested. They want to have good health. Who doesn't want to be healthy? But they also don't want to get arrested and put into detention camp, so they stay away.
Why are they leaving their home country?
It is largely economic deprivation. Venezuela's just, the economy has crashed. It's almost, there's the political unrest. Some of them are fleeing political persecution. Most, I suppose, are fleeing economic hardship. So they come here, and even in those interviews, we understand that they can't get food. They come and work here so they can send Pampers or toilet paper or buy water for their families. It's really difficult, I suppose, to be working as a sex worker and have most of that money go back to Venezuela or Cuba or Dominica and still have to pay a rent here, still have to feed yourself here. So it's not an easy, not an easy life for the migrants.
I hear per capita, Trinidad and Tobago has more migrants from Venezuela than any other country around Venezuela.
I can't imagine that to be true, and I would have to actually get statistics on that. But even in terms of, if Trinidad itself has 4 million persons, and we think we have more Venezuelans than Colombia, Guyana, or Argentina, those countries around there, then we should be seeing Venezuelans on the street all the time. Every time you see a Trinidad, you should see at least 1 or 2 Venezuelans. It's not happening, either in the day or in the night. So I don't know how true it is just on the face of it, but I would really have to see actual statistics to say that we have that many here. In any event, those who are here, I guess here in transition, they're moving to other places rather than just staying or settling here.
Have you had any conversation, with migrants about things like drug trafficking or trafficking in arms and ammunition?
You really want to go there?
No, I don't.
Then
I
don't
just
go
want to stick
there.
to HIV.
Don't go there.
But I want to know, all right, so that's it.
The gangs.
Yeah.
That is an issue. That is gendered, isn't it? That is gendered.